Welcome back to the show Talk with Your Doc, and with me is Dr. Abu Bakare, who is an endocrinologist here in Thunder Bay, Ontario, Canada. And we are talking about obesity. Dr. Bakare, you were mentioning about the diet and how to lose the weight. And you mentioned that the diet has to be a balanced diet.
That's right.
Which means it should not be too much carbohydrate, should not be too much of fat.
Correct.
And it should be balanced one. So now, how much should be the calorie intake of that diet? How much should be the carbohydrate content, how much should be the fat content, and how much should be the protein content?
Well, what we usually suggest, for example, is that the amount of carbohydrates should probably not be more than about 30% or in that area. That's a ballpark figure I'm giving. It's not that everybody should be on 30%. The amount of fat, what is left, obviously, is about 70%. Usually we can't take in more than 20 to 25% of protein, and then the rest will be, of course, fat. Now, even more important is the constituent of each one of those. Okay, for example, carbohydrate, we don't want you to take refined carbohydrate. Whether you took what we call complex carbohydrate.
Complex carbohydrates.
And if you come to the fats, we don't want you to take polyunsaturated fats. So there is also a manipulation within each category as to what is most beneficial in terms of what you should be eating.
So complex carbohydrate, which means that the carbohydrates which has the fiber content in it, right?
That's right.
So this
has
will
not
prevent
been completely refined and washed up.
Absolutely.
Yeah.
So as we were talking last time, having the fruits is important rather than drinking the fruit juice.
That's correct.
That's the complex carbohydrates.
Extremely correct. Yeah.
Right. Now, other than this diet, about exercise.
That's right.
What is the role of exercise in the weight loss?
Well, the role of exercise, we like to call it an increased activity, because you tell somebody about exercise, they think you're going to go into the gym, and all you have to do, if you walk 30 minutes, 5-6 days of the week, and total up about 150 minutes a week, that's standard exercise that is required of you. So it's not, you don't have to be a marathon runner.
So 150 minutes of walking or running or whatever the exercise you do over the period of a week is good enough to keep you, prevent you from the obesity.
That's right.
So this 150 minutes can be done over the period of 3 days, 4 days.
That's right.
You can divide it over the period and then get it done.
And you know, on each occasion, you don't have to do it all at once. You know, you don't have to do the whole 50 minutes. That day you could break it up, and it's the total that is important.
Right. Yeah. Now, the diet, exercise.
That's right.
Now, some patients, if they cannot lose their weight by diet or exercise, what are the options for them?
Well, I mean, in Canada, we don't have a very high level of the next option, which is medication. But the medication should not be on the basis of just medication. It still has to be on the basis of appropriate diet and exercise, or what we call lifestyle changes. Just handing out a medication to a patient is not really appropriate in the management of obesity. We also suggest that there are levels. I mean, if your BMI is up to about 27 or so, then you should really be on lifestyle changes. Okay? If your BMI is 27, but you already have some of the comorbidities that I mentioned earlier, hypertension and diabetes, then you should be on lifestyle changes as well as a medication.
So this medication, the drugs which are available in the prescription drugs I'm talking about.
That's right.
Do they have any side effects?
Of course, medications have side effects.
So it is better not to take them.
If you could.
If you could.
But as I said, the recommendation is that once you've gone through that level, then the medication are likely to be a component of the management. Right. While if you've got a BMI of 40, one of the components is surgery, if you can, and if you're qualified to
Tell
have
us about the surgery. What are the surgical options available for the obese patients?
Well, in Ontario at least, you are eligible to have surgery if you've got a BMI of 35 and you have comorbidities, or if you've got a BMI of just 40. You're qualified to be referred to a bariatric center so that you can have surgery done.
So
and go ahead.
Liposuction, right? You said liposuction and gastric...
No, liposuction is not really recommended for weight loss, because what you do with liposuction is you suck out fat. That's not the weight. That's subcutaneous fat you're actually sucking out. And as I mentioned,
so that's not a surgery?
No, that's not recommended surgery. The two surgeries that we mostly do in Thunder Bay, for example, are what we call a sleeve gastrectomy and a Roux-en-Y, which means the stomach is somewhat disconnected in a way from the rest. of the earlier part of the intestine and then connected to the later part of it.
So what is the advantage? Is there any advantage of liposuction?
There is no advantage in terms of medically and metabolically of weight of liposuction. It may look nicer.
It's just cosmetic surgery.
It's very cosmetic, and it's not recommended.
Not recommended.
No.
Does it have any side effects, the liposuction?
Well, I'm not sure it has any profound side effects in terms of any consequences, but it's just not anything to do with.
Now you mentioned about the other bariatric surgeries, the gastric.
There's a banding sleeve gastrectomy. Yeah. We also there used to be a band, banding, gastric banding, but that is not done in our center because also the Ontario Bariatric Network has recognized that gastric banding is not effective in terms of weight loss.
Right. Yeah. Now, how effective are these gastric sleeve surgeries and Roux and Weiss surgery?
Well, extremely effective. I mean, they normalize in a diabetic patient who has not been diabetic for a very long time. They usually normalize the blood sugars.
Blood sugar.
Almost within a few weeks. Okay. Wow. In a patient who has hyperlipidemia, they normalize the cholesterol level. And studies now that have been done in, for example, in Sweden over a 10-year period actually show that gastric surgery can reduce your mortality, both from coronary artery disease and your total mortality, early death, which occurs in patients who are overweight.
So it is beneficial.
Extremely beneficial.
Right.
Extremely beneficial.
So that's the last option. Once one cannot get physical activity or diet cannot control, medications cannot control, then you go for the surgery as the last option.
That's right.
But the best option will be the lifestyle modifications in the beginning, right?
That's right.
So eating the diet which is balanced diet rather than eating very low carbohydrate, low fat and too much protein containing diet is not sustaining for a longer time. Yeah. And having a lot of physical activity in adults and in children as well as.
That's correct.
Thank you, Dr. Bakare. I think that helps us a lot to know more about obesity. Really appreciate your time.
Thank you very much.
Thank you.
It's a pleasure.
Thank you everyone for joining the show.